that's the important question. So this is basically a question about screening. So what are the possible screening of cancer? Well, if you go to the market, if you Google it, you'll find a lot of packages being floated by various hospitals, not to name anyone. There are a lot of packages being floated by various labs and high-end labs which say that, okay, we have got a cancer screening package where they do very fancy tests and all that stuff. So I would advise you that the FDA or the Cancer Society of America has approved only 3 tests. As a matter of fact, 4 tests for cancer screening, and there are specific ages for that. It's not that anybody can walk in and get a test done. So these tests are test for breast cancer, that is mammography. But before mammography, it is important to suggest that self breast examination is the most important. That is priceless. There's no cost to it. Starting from the age of 25 years, every female, immediately after the menstrual cycle is over, because that is the time that the breast is non-tender, should do self breast examination. There are ample number of videos. You can just Google it and you can find a lot of videos how to do a self breast examination test. After that, if you are very motivated, then you can do a mammography after the age of 40 years once in a year. That is the test for females. The next test is Pap test, which is for cervical cancer. That means the mouth of the uterus. That test should be done after sexual maturity is attained, and that is generally recommended after the age of 31 years, assuming that the female gets married after that, and it is to be done once in 3 years up to the age of 65 years. So that is a Pap test where they take small amount of cells, put it on a slide and see it under the microscope whether any cancer is developing or pre-cancer is developing in the cervix. Test number 3 is for the males, that is prostate cancer. It is done by PSA, that is a prostate specific antigen. It is a simple blood test. It doesn't cost much more than 500 rupees, cost less than 500 rupees. It is to be tested once in a year after the age of 55 years. These are the tests to be done in the Indian setting, if at all it is required, because our cancer incidence is much less than America. So we can't really recommend this as a healthcare imperative. The 4th test is colonic cancer. Colon cancer, thankfully, is not very common in India. It is less than 3% of the total cancers that India sees. But it is much more common in American population, whatever be the cause. For that, a colonoscopy after the age of 50 years, once in 5 years is recommended, but it is not recommended for general population in India that a colonoscopy should be done because the cancer is not very common in the Indian setting. Yes, if somebody has a hereditary cancer, in them the colonoscopy or any other test has to be recommended at a far earlier age than the ages that I have recommended.